surgical treatment of choice here is nothing but the removal of the affected lens, and then there is a placement of an artificial lens. So you call that as an IOL, intraocular lens placement. Here you should understand we have the lens. The lens is surrounded by a capsule. This is all the more important. It is based on this capsule or the removal of this capsule, we have different coat sets. So cataract excision is primarily in two parts. One is or it is in two methods, I can say. One is ECCE and then ICCE. ECCE is a extra-capsular cataract excision. So there are two types of cataract surgeries. One is ECCE and ICCE based on the capsule, So ECCE stands for Extra-capsular cataract extraction and ICCE for Intra-capsular cataract extraction. So in ECCE what happens is the capsule and the lens. So here we need to consider what happens. The physician is going to remove the affected lens peripheral to the capsule, whereas in an intra-capsular cataract extraction, the capsule and the lens are being removed as one piece. Okay, so nowadays doctors are preferring more of a ECCE because when you keep the capsule, it helps actually, but when you remove the capsule, what happens is there is more complications that the patient is developing. But again, the physician will have to consider the medical indications also to do whether an ICCE or an ECCE. So the most preferable would be an ECCE where the capsule is kept intact, only the affected lens material has been removed. And what is the process of this removal? This we call it as a phacoemulsification. Phaco means lens, emulsify to make into a paste. So what happens is the lens is being made into a kind of a paste material and then it is aspirated by suctioning it out. So the removal of cataract is by the method of phacoemulsification. So you should understand, first time the doctor might remove the affected lens, emulsified removes it, and then he places an intraocular implant. Sometimes we have certain codes where there is no removal of just cataract, there is only removal of the affected lens material, where there is no, sometimes there is an exchange of IOL. So you need to know whether concurrently are they performing the cataract surgery or not. Next is you should always report whether the procedure is a simple or a complicated one, because for a complicated or a complex cataract we have different codes. Say for example, when the physician is going to do something like iris expansion, he is going to expand the iris and then remove the cataract, then it becomes a complex cataract removal. Or if he is going to place some adjustable sutures, you know what, normally they place sutures and they allow it to heal, but what happens here, they put some extra amount of sutures and they just retain it. Okay, so that in case there is a need for doing a further operation, that extra suture will be very helpful. So that is called as an adjustable sutures. So or a posterior Capsulorrhexis, fixation of the capsule is being done. Such extra methods are being done, then it becomes a case of a complex cataract.